Sleep is critical to our daily lives and to the healthy function of our body. Without it, our memory fails, our temper deteriorates, our head hurts, our attention diminishes, we perform poorly at work, and our personal relationships suffer. However, we often pay very little attention to the amount and quality of our sleep. I'm Dr. Jordan Stern, the founder and director of the Bluesleep Snoring and Sleep Apnea Centers. For the past 10 years, we have used innovative technology for the home diagnosis of sleep apnea. Sleep apnea is a disease that affects millions of Americans, yet 90% remain undiagnosed.
I was diagnosed with sleep apnea about 12 years ago and went to see several doctors. One of them wanted to operate, and being a singer, and the operation would have been, very dangerous to the vocal cords. I mean, it just was not a risk that I even considered.
I'm 37 years old, and about a year ago, I decided that being single with sleep apnea and some moderate snoring was probably more than I wanted to deal with at the time.
What really was the catalyst to get my butt in gear in terms of addressing this was my wife. She was complaining of snoring to the point of gargling, in terms of, you're not sound like you're snoring, you sound like you're losing air.
I'd gone to my primary care physician for a checkup. He examined me, thought that I might have sleep apnea, and sent me to Bluesleep to test for sleep apnea.
Sleep apnea causes daytime sleepiness and fatigue, difficulty focusing, headaches, memory loss, mood swings, and is associated with serious medical conditions such as high blood pressure, heart disease, stroke, diabetes, and obesity. People with untreated sleep apnea are at higher risk for serious motor vehicle accidents and job-related accidents. That's why it's really important to be diagnosed and treated if you have any of these signs and symptoms. But how do you know if you have sleep apnea? Home sleep testing can tell you right away.
My boyfriend of the time did tell me that he was experiencing a lot of sleepless nights with me because of my moderate to sometimes heavy snoring.
I've been smacked in the middle of the night, which is kind of brutal, waking up when your partner smacks you. I woke up one morning and saw earplugs in my girlfriend's ears, and I thought, what's going on here? Why? What's going out of your ears? She goes, you snore. Did you know you snore? I didn't realize it was that bad. She couldn't sleep.
Sleep apnea and snoring are caused by a narrowing of the nose and throat. That's why at Bluesleep, our sleep specialists are also ear, nose, and throat doctors. A critical part of the evaluation is an examination of the inside of your nose and throat called a nasal endoscopy. A miniature camera will be used to evaluate the inside of your nose and throat. This is a very simple and painless procedure that takes less than a minute and gives us important information about how much space you have in your nose and throat for breathing. People who come to Bluesleep often ask, which is the best treatment for sleep apnea? The answer is the treatment that works best for you. That may be weight loss and diet changes, minimally invasive surgery in the office. It may be custom-made oral appliances or CPAP for severe sleep apnea. In many cases, it's a combination of treatments, and Bluesleep is the only center that offers all of these treatments.
Dr. Stern did talk to me about my choices. So we did talk a little bit about the benefits of CPAP, which I expected, and we did talk a little bit about the benefits of surgery, which, quite frankly, I was also hoping for. After the surgery, I noticed right away, I was very excited even that first night that I was out of the hospital to see if I had been snoring. And I hadn't. From the very first night out, I think I could tell that my sleeping patterns were completely different. So I was elated.
Dr. Stern's diagnosis was that I had positional sleep apnea, and he prescribed a device called Zoma, which was essentially like a strap with a foam back that prevents me from rolling over on my back in my sleep. Began using it as soon as I got it, and I could tell the difference just from not being tired during the course of the day. It was literally like night and day, the difference.
What brought me to Blue Sleep was an oral appliance. And Dr. Stern, in turn, asked me about my history. And I had told him I was a CPAP customer, if you will, for at least 4 or 5 years. He mentioned a combination. I didn't even think about using both devices at the same time. And I think the combination of the two has made me feel a lot better.
The very first night, that night, after I met Dr. Stern, I had dinner, and I decided, okay, I'm going to start now. I'm going to start with the acid reflux diet now. And that's what I ate that night. I ate an early dinner and did not snore that night. And I'd been snoring every night up until that point. And so I noticed the effect was immediate.
Dr. Stern suggested this oral device. Within the first day, my fiance, who heard my snoring quite loudly, said it's amazing. My snoring had completely stopped, and I woke up with so much more energy. And I realized that for years, I had been living on a lower level of energy. Now, I happen to be an energetic guy, so I compensated with a lot of coffee in the morning. But this was quite dramatic, actually.
Don't wait. Come in today, have your sleep study tonight, and you can begin treatment tomorrow. Remember, there are many treatments for sleep apnea, and we offer them all here at Blue Sleep.
I feel more refreshed during the day. I have more energy during the day. I don't feel tired at 3 o'clock or 2 o'clock. I'm sitting at my desk.
Another thing you might be interested in, for all of you men out there over 50, that after I started using my oral device, my sex life vastly improved.
My life has changed since the surgery in a few ways. And I think one is relief, that I actually don't feel that I have to sleep apart from people while staying in hotel rooms.
It's just amazing the difference that I feel. Now, I feel fantastic.
This sound is me snoring. I had never heard it before until I recorded it. But every person that has slept next to me has suffered through it. That sound has ruined countless relationships for me. Okay, maybe that wasn't the only problem, but it was a big one. According to the National Sleep Institute, more than 90 million Americans suffer from snoring. And that doesn't even include everyone sleeping next to them. I tried all your standard snoring remedies. Over-the-counter nose strips, buying my partner every earplug I could find. I even considered tying my hand to the bed so I wouldn't roll over and snore. But I just wound up spending more time on the couch. I had no idea how to fix this on my own. What I really needed was professional help.
My name is Dr. Jordan Stern. I am a ear, nose, and throat and sleep specialist and the founder and director of Blue Sleep.
Dr. Stern put me through a physical exam to see if there was anything about the shape of my tongue or throat that could be causing the problem. But what I really needed to know was what was happening when I slept. So he gave me a home sleep test. The kit included a little computer, a heart rate monitor, and a breathing monitor. I slept in my own bed with the monitor strapped right to me for 2 nights. Most sleep studies happen in a lab, and they measure a variety of different sleep disorders. But the tests can be really expensive, and the wait lists are usually really long. Dr. Stern only needed a few results, and mine were bad. When you sleep, your throat, tongue, and jaw all relax. This can narrow your throat's airway. Then when you breathe in, all the soft tissue around your throat vibrates, causing that awful snoring sound. But this could be a medical condition far worse than snoring. It could be obstructive sleep apnea, a condition that blocks the throat and literally stops you from breathing while you're asleep. When this happens, oxygen is cut off. The brain goes into a fight or flight mode and then wakes you up so that you can breathe again. I stopped breathing almost 30 times an hour. Sleep apnea can lead to high blood pressure, heart disease, heart attack, glaucoma, diabetes, cancer, and behavioral problems. Not to mention, you just don't sleep well. One study illustrated that sleep apnea can cost the US up to $165 billion a year. And that's not just health costs to the patient. That's traffic accidents, workplace accidents, and productivity losses. The most common fix for sleep apnea is something called a CPAP machine. CPAP stands for Continuous Positive Airway Pressure. It forces air down your throat, keeping the airway open. There's a problem though. You have to wear this every night. Not exactly the sexiest thing. Don't get me wrong, this works, and it works really well. But studies have shown that over time, people just stop using it. And I get that. I don't want to sleep every night with this mask on. So I tried something different. It's a custom molded plastic that fits right on my teeth, kind of like a retainer. When I wear it, it slides my lower jaw forward and then opens up my airway. To make it, my mouth was 3D scanned, and then molds were made of my teeth. It has these different levels that slide my jaw forward bit by bit. It's not perfect, and it takes a little time to get used to. Every morning my jaw is a little sore because it's literally been out of place the entire night. I use this little mold of my natural bite to help the jaw get back into its normal place. But the improvements have been remarkable. It used to be that I wanted to take a nap every afternoon, but now I wake up feeling rested and I can make it throughout the whole day just going. After a few weeks of using the mouthpiece, I took another home sleep test to see what the results really were. The doctor went over the results with me over FaceTime. I didn't even need to go to his office. This chart shows all the snoring I had before the mouthpiece. All the different colors you're seeing are when I stopped breathing throughout the night. Now this chart over here shows a night with the mouthpiece. And as you can tell, it's working. Finally, I'm sleeping better, and so is the person next to me.
Live from Studio 2A in Pitts Plaza, this is the Pitts 11 Morning News with Sukanya Krishnan and Corey Chambers.
7:35. Have you ever had those bizarre nightmares that seem like, they just won't go away? You're paralyzed, you can't move, you can't speak.
Yeah, there's actually a name for this, okay? It's called sleep paralysis. Kirsten Cole's here to shed some light on who gets it and how to make it stop.
Yeah, and the crazy thing is so many of us do get this. It's so bizarre, and many people think that they're the only ones who have these weird dreams, and then they just kind of brush it off. I had them years ago. Caitlin Monty has them. She was tweeting out this morning, and that's because 4 out of 10 of us get them, usually when we're extremely sleep deprived, which many Americans struggle with. They're terrifying, anxiety-provoking, and generally completely preventable.
My entire body was just immobile. I had no control over my limbs, any movement. I was just frozen stuck, heart pounding, like I could feel like my heart was pounding out of my chest, shortness of breath.
But Dr. Jordan Stern, an expert in helping us to sleep better, says this is a phenomenon born out of our nationwide growing lack of sleep.
The entire population in the United States is sleep deprived. We do not sleep enough.
He says there's actually a straightforward fix.
At some point, we may actually become conscious in the middle of the dream, essentially. Very frightening. But it's common, and it goes away when you improve your sleep hygiene.
Stern has many ways to fix the problems that are ailing us in bed and says if we ignore our lack of sleep, the problems only get bigger.
If we don't sleep enough, lots of things go wrong. We get depressed. We become anxious, we develop high blood pressure, we develop heart disease, we develop diabetes, we have difficulty controlling our weight.
Snoring and sleep apnea are the 2 warning flags that we're not sleeping right.
How are you?
To fix, Dr. Stern uses a small in-office procedure that heats up and shrinks the tissue on the back of the tongue. A few treatments usually solve the problem. Custom mouth guards can also keep the jaw properly positioned to prevent snoring. And for those of us who've suffered the terrifying episodes of sleep paralysis, they'd do anything not to face it again.
I can remember it like it was last night.
So, for the issue, for many people, even if they're logging 8 hours in bed, it's not really good sleep because of snoring or sleep apnea, which absolutely needs to be addressed by a doctor. Sleep studies can be done at home. They're covered by insurance, and easy fixes can cure the problem.
You're watching CBS 2 News in high definition.
Ever feel a little drowsy during the day? Wish you could just sneak a quick nap at work? Believe it or not, a nap could be good for your health and your productivity. CBS 2's Dr. Max Gomez says some companies are now waking up to the idea.
Nick Herman is napping on the job, but his bosses don't mind. In fact, they encourage it.
It really rejuvenates me and gets me back. And when I get back to my desk, I'm much better at focusing and getting things done.
Herman works at Pontiflex, a mobile app advertising firm. CEO Zephyrin Lasker is a big believer in naps and set up this room so employees have a quiet place to doze off.
Well, yeah, I try to lead by example. Frequent user of the nap room.
Employees can use the room whenever they feel tired, and it's a popular place. There's almost always someone inside. And doctors say a nap can do much more than just recharge a tired worker.
It will improve your memory, it will improve your motor skills, it may even improve your creativity, it may improve your decision-making skills.
Sleep doctor Jordan Stern takes his naps in this high-tech energy pod that uses special lighting and music to promote sleep. He says regular 20-minute power naps can reduce stress and lower the risk of diabetes and stroke. A Harvard study found it can even help the heart.
Those that took a nap had less heart disease, 40% less heart disease if they napped 3 times a week.
Herman's naps last between 15 to 30 minutes. Doctors say anything longer can lead to grogginess.
I think I get things done faster with the ability to take a nap.
And that's made this a dream job. Pontiflex has seen the results firsthand. The company believes naps have made workers more productive. And they're not alone. Several major companies, including Nike and Google, allow their employees to nap. Dr. Max Gomez, CBS 2 News.
Now, just in case you think you're a slacker for napping on the job, Dr. Max Gomez says Einstein, Edison, Churchill, and JFK were all nappers.
Those are all the names I needed to hear.
Big achievers.
We need to start. You know, if they had a room like that here, there'd probably be a line out the door.
There would be. How about, though, could we work out on the job?
Yeah, just one energy pod. That's all we need here, boss.
Yeah.
Are you tired and sluggish during the day? Is snoring interrupting your sleep or your partner's sleep? You are not alone. An estimated 50 million Americans have an undiagnosed sleep disorder. Not to worry, Bluesleep doctors can help treat your sleep problem. Bluesleep telemedicine is the easy, affordable way to better sleep. Our virtual service provides testing, diagnosis, and treatment recommendations using the latest technology. Better sleep is at your fingertips with 3 easy steps. Here's how it works. Step 1. Make an appointment on bluesleep.com for a video consultation with one of our sleep doctors. You can visit the doctor from home, your office, or even the beach. Doctors are also available in the evening and on weekends. The doctor will analyze your sleep problems and usually prescribe a home sleep test. Step 2 is to take your home sleep test. You can pick it up from a Bluesleep affiliated doctor in your area or have it shipped. Just wear the device for one night and our doctors will have enough data to recommend treatments tailored specifically to you. Step 3. Review your test results with the doctor and discuss personalized solutions to help you get the best possible sleep. By using the latest sleep technologies like oral appliance therapy, we can solve snoring, sleep apnea, and more. Start living the life you want by getting the sleep you deserve. Bluesleep. Better sleep, better health, better you.
It's very likely, if you're watching us, you don't know what sleep is.
So I've actually had sleep issues my whole life, but I recently set out to fix that, and surprisingly, it worked. So we'll be sharing some of the journey and favorite sleep solutions, starting with what I like to call sleep boot camp.
It seems the more we learn about sleep, the more we learn about how crucial it is to good health.
Researchers have discovered a link between sleep apnea and cancer. We are back now with a new health alert about sleep and heart disease.
A lot of adverse effects on our immune system as well if we're not sleeping.
In other words, we're in trouble.
Hey, overnighters, anyone get more than 5 hours sleep last night? No? You either?
Notice my hand isn't up either. So I'm heading to Bluesleep's Dr. Jordan Stern to see if he might rehabilitate this lifelong insomniac. Step 1, see if it's actually insomnia that's my problem.
What's the difference between sleep apnea and insomnia?
Very different things. Insomnia is not being able to fall asleep or stay asleep, and sleep apnea is not breathing at night, and that frequently wakes people up. Sometimes up to 100 times an hour.
100 times an hour?
100 times an hour.
Apnea patients might not even realize this is happening. Treatment can be as simple as wearing a custom mouthguard. And luckily, you can now test for apnea or insomnia without going to a sleep center and getting all hooked up like Frankenstein's monster.
It's alive!
Instead, Dr. Stern hooks me up with 2 devices to use at home.
All right, I'm all hooked up to the at-home sleep apnea test. The nose cannula feels a little funny, but other than that, it's pretty comfortable.
After a few nights, we follow up via telemedicine.
We looked at the results, and in your case, there was no sleep apnea.
The bad news is I'm getting such little sleep, I can't even do the second test. But Stern says the solution isn't sleeping pills. It's cognitive behavioral therapy for insomnia, or CBTI. It trains you to fall asleep quickly and develop good sleep habits. And mine were all wrong. For starters, I go to bed as soon as I get home. But between 3 shows, that can vary from 5 a.m. to 9 a.m., not counting extra shoots.
It's important to have a routine schedule because your brain has a routine schedule even if you don't, and all of the cells in your body have a 24-hour cycle.
My second mistake, staying in bed even when I can't sleep.
You can't have the bed be associated with the anxiety that you're not going to fall asleep. So after 20 minutes, get out of bed, do something that's relaxing, and then when you start feeling sleepy, then get back into bed.
So that reestablishes your relationship as bed is where I sleep.
Yeah, and definitely not where you're bringing your computer or your cell phone or anything else.
Okay, so I pretty much botched all that. To make up for my lack of sleep, I take long naps later in the day.
Ideally, you should nap no longer than 20 minutes and try to keep it at least 6 or 7 hours before you go to sleep.
Even my pajamas were wrong.
The issue with pajamas is that they can probably cause overheating. You want something comfortable, something that's light.
Finally, my eating habits.
Do you often eat rich foods late at night?
Sometimes, you could say that.
Happy pizza day!
I got a little flavor on the bottom of the bag.
It's delicious.
Is it?
Eating a big heavy meal definitely will make you sleep badly.
Your body's working so hard to digest that food, you can't fall asleep.
That's right.
Oh, and one more thing to complicate that.
If you don't sleep enough, you can't lose weight.
I am listening.
And if you don't sleep enough and you can't control your appetite, you tend to also want to eat bad foods.
Doc, this is eye-opening.
So over the course of the next 3 weeks, I rescheduled midday shoots, quit pigging out before bedtime, found some lighter PJs, stopped napping, and started going to bed around 9 a.m., even when I got home from work earlier, and even on weekends.
It is 3 a.m. on a Sunday morning. I am exhausted and so tempted to go to sleep, but I am determined to make it to 9 a.m. Just me and Frank.
But while that wasn't easy, my biggest challenge was less straightforward.
When I finally get into bed, my mind is kind of racing and I just can't seem to calm down.
The best solution for me was something called constructive worry. A couple of hours before bedtime, quickly jot down anything weighing on your mind and the next step toward resolving each issue. It teaches your brain there's a time and place for planning and worrying, and it's not bed. Within just 3 weeks,
You're sleeping a reasonable amount of time, and the proportion of deep sleep and light sleep that you get is almost normal. If I had to say one thing, it would be that if you gave yourself an extra 1 hour in bed, obviously you might do better.
And happy to say with a few more adjustments, I'm able to sleep 8 hours a day for the first time in my life.
Show off.
But I didn't just get help from a specialist. I also got some help thanks to some products. So tomorrow we're going to have part 2 of the sleep series, Sleep Gadgets.
All right, if only I'm awake for it tomorrow. That was
You're gonna
awesome.
make it.
I learned some things.
You're going to make it.
Learned some things. For some of you, talking in your sleep would be considered a luxury because that would mean you're actually asleep, which for many of us doesn't happen.
Yeah, for me it's a challenge I finally accepted. So yesterday I showed you some of the new techniques that I learned to help kick my insomnia. Well, now it's time for part 2 of our series, Sleep Gadgets.
you know those days when your head hits the pillow and you're immediately off to a restful night's sleep? Well, I don't. I am sleep's worst nightmare.
From ABC News.
Not only do I work the overnight shift, but I'm extremely light sensitive. I have trouble falling asleep. I wake up easily, and once I wake up, I can never fall back asleep. But luckily, I found not just a sleep doctor, but some sleep products to help me.
Light is the #1 factor that controls our sleep-wake cycles.
Any sleep expert will tell you that darkness is crucial to a good night's sleep, but achieving that darkness isn't always so easy.
I find sleep masks uncomfortable, and they make for some interesting bedhead. And it seems almost every blackout shade or curtain still lets some light through. My solution? Portable blackout blinds. You might remember them from my favorite things list.
Portable blackout blinds!
Okay, I was a little excited, but here's why. They attach using Velcro strips or Velcro suction cups and offer near perfect light proofing. And you can take them with you when you travel.
Finally, complete darkness. Ow.
But just blocking my window wasn't enough. Using some peel and stick weather stripping, I was able to block light from shining through the edges of my bedroom door. And with a little black tape, I covered up all the electronic lights that were keeping me awake. Next tip, keep the room cool. But sometimes even when the room is cool, the bed gets hot. And you end up playing the old sheets on, sheets off game. You know the one. I fix this by splurging on a chili pad. It uses circulating water to keep the bed at whatever temperature you set, and it has dramatically helped me fall asleep and stay asleep. Dr. Stern also recommends the bed jet.
It's a cover that you put on your bed, and it blows air through the cover, and it adjusts the temperature. And it's been found in our study to be very effective for women suffering from hot flashes.
And if it can help someone suffering from hot flashes, I imagine it can help anyone who's dealing with overheating at night.
Absolutely.
And for a really affordable option, I've even used a gel cooling pad meant for pets. It's cheap, portable, and does the trick, which is to cool your core body temp, signaling to the brain it's time to sleep. But sometimes my brain is too busy planning, rehashing, or figuring things out to get the message. So in addition to jotting down my worries in a notebook, I also found a sound machine app helps calm my mind and helps keep noise from waking me up. I also turn on a sleep meditation.
Allow the eyes to close gently.
It helps me fall asleep, and if I get to a certain point in the meditation and I'm still awake, I know it's time to get up and try again when I feel more sleepy. To encourage that sleepiness, I often read on the couch with my weighted blanket. It's a great way to encourage stillness and relaxation, and many even use it to sleep. Finally, the most universal way to beat insomnia is to treat it with cognitive behavioral therapy. And the app Shut Eye now makes that possible even if you don't have a sleep therapist in your area.
It's a 6-week program, very affordable, and it tends to be one of the best ways to treat insomnia.
Sweet dreams.
And like with so many things, the key to any of these solutions is consistency. So pick something that works for you, form them into a daily routine, because eventually each part of the routine becomes a signal to your brain that it's time to sleep.
Wow. All right.
I know this is your favorite.
This is my favorite. I'm going to try the weighted blanket right about now.
You gonna be all right? I think Candace just... You're not supposed to knock yourself out. You're supposed to actually
I was trying to do the dog
fall
trick.
asleep. I do have
It's
some
weighted.
things that I didn't get to also in the piece that I think are pretty cool. Listening to a sleep app and, a meditation app and stuff like that.
Yeah.
If you share the room or bed with somebody else, that can get annoying for them.
Mm-hmm.
So these are sleep headphones. It's actually a headphone in a headband.
Yep.
Super comfortable to sleep with, and you just pop it into your phone or whatever you're listening to. If you do need a sleep mask, I find these to be the most comfortable. These are the concave ones, so you can open and close your eyes while you're wearing them. Very comfy. And the Nod Pod has these cool, little beads in them. That's also very comfortable. Finally, you heard the doctor say light is the most important thing. That not only means blackout shades, it means avoiding being out in the day. So if you have to be before bed, wear these really cool blue blocking sunglasses.
It's Roy Orbison.
And try to get light after you wake up.
Pretty woman.
We are back with part 3 to our series, Sleep Solutions. And while we do appreciate you sleeping with the television on, or not sleeping at all, really,
True.
We do hope you learned some alternatives this week, watching us and getting some tips on how to catch some quality shut-eye.
Okay, so we saw you go through sleep camp, boot camp, and then gear up with gadgets. And now we've got the sleep doctor who helped you on your journey back for more.
That's right. Dr. Jordan Stern from Bluesleep came by the studio to take questions from some of our viewers. And we started things off with the most common question we get: what happens if I keep waking up? A few of our viewers were asking about waking up prematurely. They fall asleep just fine, but they wake up after, say, 4 or 5 hours. Wide awake, can't fall back asleep. Is it possible that is enough sleep for that person?
It may not be, and it could be that they're waking up because of noise or because something that's going on in the environment. And many studies have shown that 7 to 8 hours or more are really better.
One of our producers actually was asking, if I get 2 3-hour blocks plus an hour of naps, does that equal 7 full hours of sleep?
The prolonged sleep allows you to get more of the deep sleep cycles.
Okay.
So it's better to try to have continuous sleep if possible.
One of our viewers was talking about sleep position. He apparently has back pain and was told by a therapist it's because he sleeps on his stomach. Is there a best sleep position for one? And two, if you want to change it, are there techniques to do that?
Left side position is usually the best. Less reflux, definitely if you're pregnant, much better for circulation.
What about when it comes to medication? Because some people are using something as simple as Benadryl or a Tylenol or Advil PM. Can you form a tolerance or an addiction to these kind of drugs?
They're not the best medication to take for sleepiness. They're not habit forming, but the best is because of the side effects of the over-the-counters to try to get off that and maybe try a low-dose melatonin, 2 milligrams, 2 hours before bedtime, and if you're having problems, see a sleep specialist.
Someone else also asked about adjusting hours. If, you know, jet lag. What is the best way to adjust when your body clock is off that way?
The best treatment for changing time zones or changing related to your work is melatonin. It's actually the drug of choice. It's very effective. Most people take too much, too close to bedtime. The best dose, 2 milligrams, 2 hours before bedtime. It's not really a sleep aid. It's a drug that helps you change your sleep cycle and your sleep time.
Caffeine and alcohol.
Okay, so alcohol will help you get sleepy and go to sleep, and you may actually get some deep sleep for about 3 to 4 hours, but then you're going to wake up, heart racing and pounding, and won't be able to go back to sleep. Caffeine can stay in your body for 12 hours. 12 hours.
What about snoring? You know, I know we didn't find any snoring in my test results whatsoever.
There were some reports of a little bit of snoring.
I snore?
Everybody snores.
Really?
Everybody snores on occasion.
So snoring is very common, but loud snoring, snoring every night, that is a sign of sleep apnea.
The CPAP is the most common treatment, and that's a machine that sort of goes over your face and forces air into your airways. But I know some people are hesitant to sleep with a machine. So can you talk through some of the other options that can help when it comes to treatment of sleep apnea?
A simple mouth guard that is molded to the teeth and keeps the jaw forward a little bit, stops the snoring and helps you breathe. It's a very good treatment. It's really something that most people and doctors don't know about, but very effective. Also losing weight and body position, sleeping on your side.
And a lot of people, I think, when they talk about apnea specifically, they think overweight men, because that's the most common population. But I have I think he was 8 years old, cousin, who was diagnosed with sleep apnea.
Well, you bring up a very good point, children. About 2 to 4% of children have sleep apnea. Usually it's because they have big tonsils. Take out the tonsils, they start growing, they start flourishing, their behavior improves.
What if the problem is just snoring?
There are other treatments, but similar to the sleep apnea treatments, the mouth guards, for example. They can eliminate snoring in our studies, 95% of cases.
Because you might have someone who's, oh, I sleep fine, but your spouse doesn't because you're snoring all night.
That's right.
They will very much appreciate the mouth guard, I'm sure. Well, Dr. Stern, thank you so much again. You have literally changed my life, and hopefully bringing this story to others, we will be able to pay this forward to many of our viewers out there.
Great. Thank you, Diane. Sleep is the basis of health, and I'm glad you're letting your viewers know that.
So can we go to sleep now?
Yeah.
All right, we'll take a quick power nap. Oh, that nap was so nice.
How long did that last
I
for?
really enjoyed it. The director had to come and poke me awake. But I just want to punctuate two big points here. Again, with the melatonin, so many people are taking 5 milligrams at least because it usually comes in that dose.
Yeah.
Again, he says 1 to 2 milligrams 2 hours before bed. Very important to not take more than that.
Okay, so I'll take it now. 2 hours before bed.
And the best treatment for insomnia is cognitive behavioral therapy for insomnia. Those are the two, I think, really big takeaways.
Le secret de toute réussite. Réfléchissez 2 secondes. Si vous avez vu le générique, bien évidemment, vous avez déjà la réponse. Sinon, petit effort, le secret, le sommeil. Si vous ne vous êtes pas bien reposé, vous allez manquer d'influx nerveux et à un moment donné, malheureusement, ça tournera mal. Par conséquent, nous aurons tout à l'heure Johan Stern, il est médecin. Il va nous décliner la meilleure façon pour dormir au point. Jordan Stern, médecin américain. il est vrai que le sommeil est l'un des points dans lesquels nous avons énormément de paramètres à régler, puisque je crois que les statistiques montrent que 70% des Français ne dorment pas très bien.
70% ne dorment pas très bien, 30% ont des maladies du sommeil, et dans le monde entier, 1 milliard de personnes souffrent de l'apnée du sommeil.
Alors l'apnée, ça veut dire, là on va faire technique, ça signifie, comment fait-on de l'apnée? Est-ce que c'est parce qu'il y a ce fléau des adipeux qui se retrouvent un peu trop en largeur, en étoffe?
Oui, c'est sûr. Alors, si on est obèse ou on fait du surpoids, c'est quasiment sûr qu'on ait un syndrome d'apnée du sommeil. Mais même les enfants qui sont petits et maigrichons, des apnées du sommeil, ça peut être un problème de la langue, des amygdales. Ce ne sont pas que les obèses qui font de l'apnée du sommeil. C'est important de le savoir.
Et alors, on va pouvoir régler tout ça. Théoriquement, il est impossible de rester, et sans utiliser de médicaments, il est impossible de rester dans cette nuisance du sommeil dissipé toutes les nuits.
Et non. Par exemple, l'apnée du sommeil. Une apnée du sommeil sévère, il se peut qu'on s'arrête de respirer jusqu'à 100 fois par heure.
D'accord.
100 fois par heure, une apnée d'apnée sévère qui n'est pas traitée peut entraîner une mortalité dans les 15 ans depuis le premier symptôme. Donc c'est très important de diagnostiquer et de traiter.
Est-ce que ça signifie aussi qu'aujourd'hui, si on sent que malheureusement on ne s'endort pas bien et autres, il est bon d'aller consulter et que l'on a les moyens de comprendre quelles sont les raisons, donc de poser un vrai diagnostic sur cette difficulté à s'endormir ou à bien dormir? Oui, alors les difficultés à s'endormir et rester endormi, ce sont des problèmes d'insomnie, souvent que l'on traite avec des traitements psychologiques, l'anxiété par exemple, de bien traiter. Sinon, pour les problèmes d'apnée du sommeil, on peut les diagnostiquer avec des nouvelles technologies qui sont minuscules, qui peuvent être posées sur le doigt et qui peuvent diagnostiquer. Alors là, par exemple, allez-y, parce qu'il est venu lui aussi avec son petit matériel.
Alors par exemple, presque la taille d'une pilule, c'est une nouvelle technologie que l'on pose sur le doigt le soir et le lendemain, et on a les informations sur les apnées qu'on a fait pendant le soir. Les apnées, le ronflement, la position du corps, et avec ces informations transmises sur un téléphone portable, on a le diagnostic. Et donc avec ces nouvelles technologies qui sont faciles à utiliser, qu'on utilise à la maison, on peut suivre le sommeil pendant 2-3 nuits, 7 nuits.
Jordan Stern, ça, c'est un dentier, c'est quoi?
Oui, alors ça, c'est pas un dentier. C'est un traitement pour l'apnée du sommeil. Alors, je sais que la plupart des gens pensent que l'apnée du sommeil est traitée par un masque et une machine. C'est vrai.
Ah oui, carrément.
Pour aider la respiration. Mais ces traitements-ci, qui existent aussi depuis quelques années, sont des orthèses mandibulaires que l'on pose, que l'on met dans la bouche le soir et qui maintiennent la mandibule inférieure, donc la mâchoire inférieure, en position avancée et qui empêche non seulement l'apnée du sommeil, mais aussi le ronflement. Donc un traitement pour le ronflement.
Et puis il y a ceux qui crissent des dents aussi.
Voilà, et ça protège aussi les dents, parce que souvent les gens avec une apnée du sommeil ont aussi des problèmes de grincement des dents, c'est vrai.
Dans les livres qui sont les vôtres, mais qui sont des livres en anglais, donc on ne les a pas apportés, mais vous avez la gentillesse de me les traduire. Oui. Entre autres, vous évoquez les fameux reflux.
Oui. Alors les reflux gastriques, 30 à 40%, même 50% de la population.
C'est l'un des médicaments les plus vendus, il paraît, qui est très toxique comme médicament.
Voilà, et c'est pour ça qu'on a écrit ce livre, pour éliminer le traitement par médicament et remplacer le traitement médicamenteux par un changement de l'alimentation très simple. On évite les aliments gras, on évite les aliments qui sont préparés et qu'on achète tout prêt, qui sont acidifiés.
D'accord.
Donc, c'est pour ça qu'il y a de plus en plus de problèmes de reflux œsophagien. Et aussi, si on ne traite pas le reflux œsophagien correctement le soir, on ronfle.
Voilà, et il y a des brûlures, des sensations de brûlure. L'alcool, évidemment, est un des autres phénomènes majeurs actifs en la matière.
Tout à fait.
Le café ?
Le café, prendre un café le matin.
Mais à partir de 4 heures de l'après-midi, on oublie.
Voilà, exactement.
Et pas plus de 4 par jour, c'est ça,
4,
en gros
4.
Ah non, je ne sais pas, je pose la question.
Peut-être un café le matin, peut-être un café début d'après-midi.
Et puis après, on passe
voilà, parce que sinon, ça reste dans la circulation pendant 12 heures, la caféine.
Il nous faut aborder aussi, c'est la logique de la sieste. Aujourd'hui, il semble que scientifiquement, c'est admis une bonne fois pour toutes, il est bon d'avoir une sieste. Mais si je vous ai bien lu, pas spécialement une sieste très courte, elle peut être un peu plus longue, mais c'est véritablement un bénéfice pour être constamment dans l'énergie.
Tout à fait, ça dépend un petit peu de ce que vous voulez accomplir avec votre sieste. Alors si c'est vous voulez créer une œuvre d'art importante, alors vous pouvez faire une sieste de 2 ou 3 heures peut-être. Ça va
carrément
augmenter votre potentiel d'imagination et de créativité.
Est-ce que ça veut dire qu'à ce moment-là, je vais réduire ma nuit? Parce que sinon, je passe mon nuit au lit. Oui. Cela dit, Voltaire passait une bonne partie de sa journée au lit.
Voilà. Mais donc la sieste avant 4 heures de l'après-midi. Mais si c'est pour simplement des décisions que vous allez prendre dans l'après-midi, que vous vous sentez quand même somnolent, une sieste de 20 minutes maximum. 20 minutes maximum, très efficace.
Vous dites 3 heures avant, il est bon de se couper de tous les écrans et de se mettre dans une sorte de sérénité, c'est ça?
Oui, mais vous savez que la performance le lendemain, vous avez eu un sportif et un créateur de pâtisserie, de pouvoir mieux travailler le lendemain en dormant plus, c'est quand même très important de se dire qu'on doit avoir une journée plus longue, mais de privilégier le sommeil, 8 heures de sommeil quand même.
Mais est-ce que l'on pourrait avoir un sommeil de 8 heures, mais même fractionné, et que ce soit bénéfique? Et comment organiser ce sommeil fractionné?
Il marche moins bien parce que pendant le sommeil, on veut obtenir du sommeil profond et du sommeil paradoxal. Et le sommeil paradoxal est le sommeil le plus important. Et si on coupe, si on ne dort que 10 à 15 minutes, souvent on n'obtient pas du tout de sommeil paradoxal.
L'une des dernières questions, c'est simple. Bon, les médicaments, on oublie, d'abord parce que ça agit sur les neurones, c'est vraiment très, très, très nocif. Non, mais on ne le dira jamais assez. Mais est-ce que des tisanes, c'est un effet placebo pour...
Non. La camomille a été étudiée en fait sur les rats.
Oui.
Et ils dorment mieux. C'est pas un effet placebo. Un bain chaud aussi, c'est pas un effet placebo. Ça augmente la température du corps et en fait, ensuite, on se refroidit en sortant du bain et c'est ce refroidissement qui nous aide à dormir.
Et est-ce qu'il y a sinon d'autres procédures auxquelles je n'aurais pas pensé, que je n'aurais pas complètement lu dans votre livre ou que vous n'auriez pas traduites, que vous pourriez nous communiquer là?
Alors l'importance de la lumière bleue. L'importance de la lumière bleue. Et c'est pour ça que d'éliminer les écrans, c'est pas seulement le contenu de ce qu'on voit, mais c'est aussi la lumière bleue qui empêche la mélatonine de monter dans notre corps et de nous endormir. Donc c'est très important.
Est-ce que ça veut dire que les yeux de mouche comme on a dans les avions, c'est l'une des bonnes façons?
Oui, c'est très facile et ça marche très bien. Et aussi le bruit. Parce que pendant la nuit, qu'est-ce qui nous réveille? Quand on se réveille la nuit et qu'on ne peut pas dormir, quelque chose nous a réveillés. Le plus souvent, c'est le bruit.
Très bien. Jordan Stern, médecin, il est américain, il passait par là. Voilà, merci beaucoup. Bon vent pour l'été. Au revoir. Merci à toutes les équipes.
Something else that's causing a narrowing of the nose, and you've done everything you could, you might try over-the-counter decongestants. Just try them for a week or two. Otherwise, you could become addicted to some of them. Some of them are non-addictive, but I don't want to get into prescribing anybody medications here. I want to keep it simple. So, nose is important. You need to be able to breathe freely through the nose. That helps with some people who have snoring because of narrow nose. Let's move on to body position. What can you do about relieving snoring if you've been told that you snore in one position or another? What is the best sleeping position for snoring? Does anybody know? What is the worst position for snoring? Let's put it that way. The back. The back is the worst position for snoring because frequently the jaw drops, and when the jaw drops, the tongue narrows the throat and you start snoring. So the best position to try to avoid snoring is to sleep on your side. The left side is the best, especially if you're pregnant. The actually best position is called the sniffing position. So the sniffing position, like this, if you're sniffing, that's something that you learn if you're an ear, nose, and throat surgeon like me, because when we do surgeries and we want our patients to breathe when they wake up, we have to put them in the sniffing position, which is flexion of the neck and extension of the head. So there's lots of pillows that are being sold here, and some of them may help you maintain that position. So if you want to challenge the salespeople here today, go to their booth and ask them if their pillow will maintain your head in the sniffing position. We'll see what happens. But that would be helpful. So left side definitely better. If you're going to be on your back, too many pillows will flex your neck and that'll make you snore. But if you have a pillow and you have the pillow under your shoulders, that may help flex and extend, which is really what you want. All right, so you can try that. Easy things. Thirdly, we're going to get into food, and that is the biggest risk factor for snoring. The absolute biggest risk factor for snoring for people who don't snore usually is what? Alcohol. Why is alcohol such a problem? Because alcohol relaxes the muscles that keep the throat open. So you start falling asleep, had a great drink, you're going to fall asleep right away, you'll get into deep sleep really easy, but sooner or later you're going to snore very loudly and you're going to get poked on the side, or worse, you're going to stop breathing repeatedly. Certainly if you have a risk for sleep apnea, which means that your throat is narrow and you tend to stop breathing at night, alcohol will make it significantly, dangerously worse. So, best not to drink alcohol at night before you go to sleep. I won't say anything about drinking alcohol for breakfast or lunch, as long as you're not sleeping. So alcohol is probably the biggest thing that you can avoid if you don't want to snore. But I think we all know that. The other thing is what? Eating too much. Because being overweight is a big risk factor for snoring and sleep apnea. And losing weight is one of the only cures for snoring and sleep apnea. There are very few cures because there are treatments. So you're taking medication, you're wearing an appliance, you're wearing a CPAP. That is a treatment. But a cure for snoring and sleep apnea would be weight loss. Doesn't work for everybody. But sometimes losing 5 pounds can stop your snoring. So definitely something to put on your schedule. Lose 5 or 10 pounds and hopefully stop snoring. So you might have known about weight and alcohol. What about salt? Salt? Why would salt cause snoring? So if you eat salty foods, you may recall that if you're having a very salty meal, you wake up in the morning, you have bags under your eyes, and you kind of wonder, why is that? That's because during the day, the extracellular fluid, which is the fluid in our body, falls to our feet. And when we lie down at night, it comes back up towards the head. It causes bags under the eyes, but it also causes swelling in the throat, which causes snoring. And it narrows the throat. Salty foods can make your snoring worse. Something else, acid reflux. Probably you've all heard about acid reflux. Acid from the stomach that kind of creeps up into the throat. During the day, it could be burping or heartburn. At night, you don't really know what's happening, but it is, and you may be coughing in the middle of the night, you may be clearing your throat, and that acid causes swelling of the throat, and the uvula, the little punching bag in the back of the throat, that can swell. Sometimes you'll wake up in the morning and you'll see, why is that so swollen? That's probably because it's been irritated by acid at night, might have been irritated by salt as well, also irritated by snoring and vibrating all night, okay? So definitely something to try to avoid at night are foods that cause acid reflux. A pitch for my book called Dropping Acid, the Reflux Diet Cookbook and Cure, which explains which foods cause reflux and which foods don't. So foods that cause reflux are foods high in acid, foods high in fat, spicy foods, and a lot of people tell me those are all the foods they love. Pizza is an example of something that's going to cause acid reflux. So again, maybe have the pizza for breakfast, but don't have it for dinner because you're going to have difficulty sleeping. And what else is a big problem is eating late and going to sleep right away. You're horizontal, you got a lot of food and water and everything in your belly, that's coming straight up. It's going to cause swelling and burning of the throat, and it's going to make your snoring worse. It will also wake you up all night. You're not going to sleep well. You will not feel rested in the morning. So things that you can do: clear the nose, avoid the pollen, wear sunglasses, rinse it out, shower before you go to sleep. That'll take care of your nose. If that doesn't work, there are over-the-counter medications that will help you breathe. Sleep is critical to our daily lives and to the healthy function of our body. Without it, our memory fails, our temper deteriorates, our head hurts, our attention diminishes, we perform poorly at work, and our personal relationships suffer. However, we often pay very little attention to the amount and quality of our sleep. I'm Dr. Jordan Stern, the founder and director of the Bluesleep Snoring and Sleep Apnea Centers.
I have produced, together with Dr. Stern, the custom-designed music for the energy pods, which one will find in various banks, in Google headquarters. We're noticing more and more employers taking advantage of that technology to help their employees maximize their time in the office.
Music is critical to helping patients with insomnia and sleep apnea relax into a state of drowsiness and deep sleep. Studies have shown that classical music can help patients improve their compliance with treatment of CPAP.